Right. Thank you so much for being here today to the first ever Malaysian Young Minds Conference. My name is Els Dines and I'll be your host for today. We have loads of amazing things in store for you. But first of all, give yourself a big round of applause for being here this morning. Wow. Okay, right now, please put your hands together and welcome Dato Dr. Chong Chee Kheong on the stage to give a few words.
Thank you very much to my MC. Yang Berusaha Puan Noraini, CEO Lembaga Promosi Kesihatan Malaysia. Yang Berusaha Dr. Maliki Muhammad Rafi, Pengarah International Youth Centre. Yang Berusaha Dr. Nasru, President of the Scopus Malaysia, Social Community Programs Urban Society. Yang bahagia Dato-Dato, tuan-tuan dan puan-puan. Selamat sejahtera. Terlebih dahulu saya ingin mengucapkan selamat datang kepada semua para peserta ke conference First Malaysia Young Mind Conference yang bertemakan Empowering Mental Health Advocates. Saya juga ingin mengucapkan ribuan terima kasih kepada pihak penganjur kerana sudi menjemput saya untuk hadir di upacara perasmian seminar pada hari ini. Izinkan saya cakap dalam bahasa Inggeris. Please allow me to continue my speech in English as I understand that there are our visitors from abroad in this room. If I'm not mistaken, I was told that we have Japanese. So, konnichiwa, hajime mase, watashi wa Chong desu. I also understand there are people from France. So, bonjour, salut, bienvenue à Kuala Lumpur. I understand there are people from the Middle East, but I can't speak Middle East, unfortunately. And I understand there are also representatives from Holland, and I can't speak Dutch. So anyway, welcome everybody to the conference, the first Malaysia Youth Mind Conference. According to the WHO statistics, preventing suicide a global imperative. 800,000 people in the world commit suicide every year. This translates to one suicide every 40 seconds. And for each incident of suicide, there are actually another 20 attempted suicides. These are very scary statistics. And in the world, globally, suicide remains the 10th top causes of death in the world. And for the age group of 15 to 29, where most of us are, it is the number 2 cause of death in the world. Scary statistics. But what about Malaysia? What about the numbers in Malaysia? According to the National Suicide Registry for 2010, that was about 10 years ago, our suicide numbers is 1.3 per 100,000 population. So if we have 30 million population, you need to multiply that by 30. So it's roughly about 39 per successful suicide in Malaysia. But according to more latest, our recent statistics from the National Health and Mobility Survey in 2017, suicide behavior, which includes successful suicide, attempted suicide, suicide planning, and suicide thoughts. The prevalence for suicide behavior has increased in 2017 to 10% from 7.9% 5 years ago, 5 years earlier. And planning to commit suicide has increased to 7.3% as compared to 5 years earlier, 6.4%. And the act of committing suicide is now 6.9% in 2017, the time of the study, as compared to 5 years earlier, which was just 6.8%. So all in all, we notice that the suicide behavior has increased, be it planning, attempting, or ideation. The causes for suicide are many. It can be individual or it can be society. Individual causes such as the lack of coping skills, lack of ability to deal with peer pressure, lack of ability to deal with relationships, lack of ability to cope, lack of coping mechanisms to cope when we have problems, even problems that are sometimes beyond us, when we are afflicted with a rare disease, like if one of us gets HIV, one of us gets AIDS, or we are diagnosed with cancer. This kind of individual problems causes a lot of stress. But the problems of suicide are not only just individual, it is also society. Society because in society we have to deal with employment or the lack of. Sometimes because we are not employed, or we are employed in a job that gives us low pay, or we fall into the trap of substance abuse, especially among youths. This is one of the problems. Or we happen to be unlucky, born into circumstances where we have to stay in areas where there are a lot of negative influences, gangsterism, bullying, and other factors, drug abuse. So this kind of situations of society causes a lot of mental stress for all of us. But irrespective of whether the causes are individual or society, it is important to understand that suicide behavior is preventable. And that is the key message that I think this conference is trying to impart on us. The Ministry of Health recommends that the first place that we must search for help is always our family members, our close friends, and our friends who surround us. Even friends that are not so close. Family members and close friends represent the roots of a tree that holds the tree together. Our friends, our social circle represents the grass around the tree, without which there will be erosion of the soil that will bring again to the tree falling down. So friends, family members, our social circles are very important to keep us mentally active and mentally strong. But sometimes turning to your family members, turning to your friends are not enough. Not enough, not because we don't care. Not enough because, number one, in our culture, our Asian culture, we don't open ourselves, we don't express ourselves. We were never taught as a young child how to share our feelings, how to emotionally support another human being. At the same time, while we may want to help our family members and our friends, we may not be equipped with the knowledge or the know-how how to deal with situations that are emotional in nature. Thus, it is important for us that we spread the message and we start training people who knows how to deal with this situation. And of course, if we talk about problems that are more of society in nature, like unemployment, like drug abuse, the government has agencies like the Anti-Dada Negara, the drug, in English, we have agencies to tackle substance abuse, to tackle drugs as a society problem. We have agencies, the human resource agency. They deal with helping people to search for employment. So if you have friends who have problems similar to those, you can always refer them to these agencies. The question you need to ask, of course, is where are these contact points for these agencies? So I hope that in today's conference, things like this are also touched upon. It's easy to say, look up the Ministry of Manpower to look for a job. But when you want to do that, you'll be struggling. What's the address? What's the handphone number? What's the website? So I hope that we can deal with that. Now, and I think it's also especially fortunate that in a country like Malaysia, we also have non-government agencies. Non-government agencies such as where we are today, where you are representing, the Scopos. Non-government agencies that help those who need help. So we also have other NGOs, I think there are quite a number of them, Befrienders for instance, where they offer telephone access on a 24-hour basis. So those of you who need help can actually call up the hotlines of those organizations to seek help. And We happen to live in a country where we have three major races, the Malay, Chinese, and the Indians, and many, many more other races in Sabah, Sarawak. And all of us have our different cultures, our different religions. But no matter what religion or what culture, I think it is safe to say that all religions put emphasis on life and living. No religion will advocate suicide as a means of living, as a means of practice, as a means of culture. So in that respect, religion and culture plays again an important aspect of mental health. So I will not dwell too long on my opening speech, as I am sure that all these areas, all these perspectives will be dealt with today. I understand that this conference today involves a huge number of youths between the ages of 15 to 35. And I'm very happy to see all of you here today. Being with young people makes me feel young. And we also not only have the Ministry of Health and other agencies, government agencies, it is also important that we work together with the non-government agencies, be they in the private, like the schools and institutes, or in the workforce. So it is my wish that from this conference, you will gain the knowledge to become health advocates when you go back. When you go back, you can, if possible, train more health advocates, what we call training of trainers. Or you can be the pillar of support for those who need help within your circle of friends and peers or family. Or at the very least, I hope that you can spread the message that if you're in need of help, there are places where you can seek help. Last but not least, we must not forget that if we practice a healthy lifestyle, it goes a long way towards mental health. If we were to take part in sports, take part in societies, events, like youth clubs, among your workplace if you are working, join your fellow office mates for social functions. All these things, engaging in a healthy lifestyle, sports, and other things, will help you build your mental capacity and your mental resilience and your coping mechanism. So we always practice and advise and advocate a healthy living. In the Ministry of Health, healthy living is not only for the mind, it's also for the body. So we have things like exercise. Make sure you exercise every day. Youth today are not very fond of physical exercise. They exercise their fingers playing computer games. They exercise their mouth talking a lot, but they don't exercise their body. So we would like everybody to exercise physically. I believe that we have an X-break soon. Yes. So that will start us off in the right direction. We also like to advise people to eat healthily, because eating is actually very, not only nutritious, but good for the soul. If you eat the right food, you can actually feel happier. If you eat the wrong food, you may actually feel sad. So I want everybody here to eat the right food and feel happy. Cakes are not the right food. Sweets are not the right food. Sugar is not the right food. You feel happy temporarily. Eat more vegetables, eat more fruits, you feel happier. I feel happier when you eat more fruits. I hope you feel happier too. So anyway, we have a healthy lifestyle message that we would like to share to you, and I hope that in this conference we also can manage to share that. I hope that when we have lunch served today, all our food is calorie tag, that we have how much calorie there to tell you that you should not eat so much. So finally, last but not least, let me conclude by saying thank you and congratulations to couples for having successfully convening this conference, to the International Youth Organization for collaborating with the couples as well as the other ministries, to all the participants who took their time to be here today, to learn more about life, to help themselves, and to go back and help others. And for the better of our country, let us be strong mentally and physically. So with that, I'd like to say thank you and enjoy your conference today. Thank you very much.
Thank you very much, Dato. Wow, amazing speech. Yes, I think we can all agree that we learned something today. For mental health, you need to have good body, good sports, you need to have good physical activities, yes? So before we actually go to the official launch, as Dato has mentioned, we have prepared Zumba session for you, a 10-minute Zumba session, okay? Because it's not only about active mental health, right? It's about physical health, yes? Okay, very good. So, right, today, please welcome to the stage Team Zumba MYMC 2019.